Welcome once again to another educating and entertaining episode of Health Unplugged brought to you by Lifeway Medical Diagnostic Hub. This is a place where we discuss important health related issues that matters to not just the mother, the father, the children, but everyone in the society. My name is Amazing Rita. So last week we talked about hepatitis B, what it is, how it affects your liver, how it's being transmitted, and the symptoms of hepatitis B, and many more. You find those on our previous episode. So do well to go and watch it and learn something about hepatitis B. So we're continuing today and we're still talking about hepatitis B, a silent threat to your liver. Of course, I'm not alone in the studio. I have with me Dr. Favor Dimba. Hi, Dr. Favor.
Hello.
You're always so cool, calm, collected.
Okay. I'm excited to be here.
You
Again.
are? But it's not showing. Like, someone say, yeah, excitement.
I need to do all of those to show that I'm excited.
All right, so today we are still going to be talking about hepatitis B, how people who are living with it can manage it, and how you can prevent yourself from having or contacting hepatitis B. So last week, while we were concluding, Dr. Favor was telling us about the vaccine. So you said that we have 3 doses of the vaccine,
Yes.
and they are taken at intervals.
Yes.
Then you said it is 95% effective.
Yes.
Okay, so that's for vaccination for those who are not infected with the virus, right?
Yes.
So for someone who is already infected with hepatitis B, what's the next way forward?
Okay. For someone already infected with the virus, it depends on the stage. Previously I said there is the chronic and then the acute. The acute, I said less than 6 months.
Yes.
And in the case of an acute phase, it still depends on the level. When it's in the early phase, it can go spontaneously.
Okay.
Recall I told you hepatitis virus is a viral infection, and viruses can be self-limiting, as in sometimes you may not really need to do anything. That's what self-limiting means. Yes. So if it's in the early stage of being acute, it could regress spontaneously. That's the person could get healed spontaneously without doing anything. But then at some level of the acute phase, you would need to treat symptomatically. What do I mean? The symptoms the person is presenting with, that's if it's still in the acute phase, will need to be treated.
Okay.
Then dietary modification, because there are some foods that are not healthy for someone having the virus already.
Yeah.
Yes, you have to do dietary modification. The person would need to stay hydrated and bed rest. While if the patient is already in the chronic phase, it still depends on the extent. Because I told you the liver is one of the self-generating organs in the body. Yes. If the affectation in the liver is just very little, the liver could regenerate itself and heal itself. But if it's in the chronic phase, then the patient in the chronic phase and very severe, the patient will now need to be on antiviral medications. Some antivirals are used to treat hepatitis B. And not just being on those antivirals, the person will need regular checkup. What is the person looking out for? The liver function test.
Okay.
And then the viral load to see if he or she is improving with these medications. Some of the antivirals they have tenofovir, they have famciclovir. So these are examples of antivirals. However, researchers are still trying to get novel therapies where they'll start using immunotherapy to treat the virus.
All right, these drugs, the medications, are they available in Nigeria?
Of course, they're available in Nigeria.
And they are not just available, like people can easily get it.
Yes, they can be gotten very easily, though not in every center per se, but it's readily available in Nigeria, yes.
So the cure, is it lifelong?
Yes, for someone who is already in chronic phase, remember, and on antiviral, the person will have to be on a lifelong lifelong therapy.
Okay.
But then it also depends on recall I told you, as the person is on the antiviral, he or she will need to do a regular checkup to check if there's an improvement in the
Okay.
liver function, and then to check if the viral load is
It's reducing.
decreasing. Yes, so with this regular checkup and then response to the antiviral, you know if there's progress. But most times, if it's very chronic, the person will have to be on lifelong
What if,
medication.
okay, for an instance where the stage is still an acute one,
Okay.
then the person takes medication, gets cured. Will the person need to continue taking that medication?
Okay, like I told you, there's room for self recovery.
Yes.
Yes, in that case, you know that at this stage, this liver has not really been tampered with. So the liver is also regenerating itself,
Itself.
and then the person is, if there are symptoms, person is treating the symptoms while the liver is regenerating itself. So in a case like that, in that instance, the person won't be on lifelong treatment, because as the person is treating the symptoms, the person will equally be going for a liver function test to check the optimicity
Of the
of the
liver.
liver, and then if it's optimal, you can stop the antiviral, but not just on your own, with your healthcare provider.
So how do people know, or how would people who are infected with hepatitis B
Okay.
know if theirs will go on its own, or they will need to go and see a doctor, then they will need to do the treatment plan, medications and
Forever.
everything.
Okay. Like I said, it depends on the chronicity, on the
So they
extent.
can't know on their own. Like, it's not like there are signs they would see or something.
No, recall in our previous session, we had pre-icteric, icteric, and post-icteric
Derek, yeah.
symptoms. Then, like I also said, it depends if it's in a chronic patient, a patient having chronic hepatitis, and then the extent to which it has affected the liver. Yes, if the cirrhosis has eaten so much into the liver, because cirrhosis is where the healthy liver cells are being replaced,
Okay.
yes, by unhealthy cells. Yes, so if the extent to which this has occurred if it has gone a great extent, you know that that liver would not be able to regenerate on its own. The function will not be optimal. So for in a case like that, there are some symptoms you would see, but then it's always important to see your healthcare provider, because it's not just about you staying in your house and saying, I'm seeing these symptoms, so I know I'll be on these medications forever. Or I'm not seeing these symptoms, and I know I will be on these medications forever. So, like I said, there's always a conjunction with doing the liver function
Test.
tests, checking the viral load, and then having consults with your healthcare provider to know the extent and to
Okay.
know if you would taper the medications or stop, or if it would be lifelong
Lifelong.
years.
All right. So you also mentioned something about diet. Like if for someone who is treating hepatitis B,
Yes.
I don't think they eat everything. Can you tell us more about that?
Okay, for someone treating hepatitis B, there's what we call protein of high biological value and protein of low biological value. Protein of high biological value is majorly plant animal protein, while protein of low biological
Plant
value is
protein.
plant protein. Yes, so you don't want so much protein of low biological value in patients with hepatitis.
Okay.
Yes, the reason is because when it's broken down, you don't want to tilt this patient to a stage where he or she will have encephalopathy, and that's when the urea accumulates and then it gets to the brain, crosses the blood-brain barrier. So you're trying to avoid that. We call also alcohol. Alcohol also
So wait, are
causes,
you
okay,
saying they would take more of low or they will take more of high?
they should eat more of protein with high
High.
biological value,
Oh,
yes,
okay.
animal protein, and
Okay.
avoid more of low
Low.
biological value,
Okay.
plant protein.
Okay.
Yes. Then also things like alcohol. You know, alcohol on its own, it's not even healthy for the liver. Consumption of excess consumption
Alcohol.
of alcohol, yes, because it could also help the cirrhosis progress faster. Then you want to cut down their sodium intake. Sodium as in salt. You want to keep them hydrated. They need to stay hydrated all the time. Then they need a lot of fruits and vegetables. Then they need to avoid canned foods, very fatty foods that are very, very fatty, because you're trying to prevent the liver from going you're trying to prevent that patient from having fatty liver.
All
So
right.
yeah.
Someone living with hepatitis B,
Okay.
can they have a normal life? Work, get married, have children, just live a normal life? Or does the infection affect their everyday lifestyle?
Okay. Yes, someone with hepatitis B can live a normal life, but then under some conditions, first of all, compliance with your medication is very important, because once they are not told to stop their medications and then they stop, it could the virus could further multiply, and then what you are trying to
Apple.
limit would progress. The person will go into a relapse. That's one. Then secondly, the immunity of the patient. If it's someone that is immunocompromised, like someone who has been on long-term steroids, someone who has HIV virus, someone who is just immunocompromised, yes, you know that person will have difficulty coping as compared to someone whose immunity is
Is
not
strong.
compromised. Yes. So in generally, I think someone with hepatitis B can still go ahead with his or her normal life, provided he or she adheres to the medications. Always, always, always attend your clinical visit or appointments. See your healthcare provider. Stay healthy, like what you consume, like dietary modification. Yes, it's very normal for someone with hepatitis B to live a normal life.
Okay, so apart from the diet, the
Okay.
alcohol, what other lifestyle modification should they look
Okay,
into?
generally, recall when we had our last
Session.
session, yes, we said sharing of sharps is also a means of contracting. So this patient living with hepatitis B, apart from observing all those previous things, staying hydrated, adhering to medications, the person would also try to be careful. Like when the person goes to the hospital and then there are parenteral medications to be given, the person will need to be more careful, because at that stage, if it depends on the level to which the cirrhosis has occurred or the hepatitis has affected the virus. But you know, if it's very, very bad, the patient's immunity is already reduced to an extent. So the person would need to be very more careful to avoid things like co-infection,
Okay.
because someone having hepatitis B could also contract hepatitis C. They
Oh,
go hand in hand, yes. So you have to be more careful.
careful.
Yeah.
Oh, so as individuals, like people that are not infected with the hepatitis B,
Okay.
what lifestyle modification should we do? You know, just to help ourselves to make sure that we don't, apart from sharing of sharps, we
Yes.
don't contact
This
this
virus.
virus.
Okay. I think what I can say is this. First of all, the individual trying to prevent himself or herself from contracting the virus would have to be very careful. In a situation where the patient maybe needs something like blood transfusion, you should ensure the blood is properly screened before it's transfused. Ensure it's void of the virus, and be mindful and careful when using sharps. It's not just about needles, like when you want to take parenteral medications, but also a razor blade is also a sharp when they go
Sharp
to have their hair
hair.
cut and all of those. Then also being true and faithful to your partner. For example, you're a couple, don't like be true to your partner. Example, you're trying to get married and then you know you have the virus. Try
Yes,
to relate
to
this to
them.
your partner. Yes, then I think awareness, generally creating awareness to the public to try to be careful using sharps, and then those ones who do intravenous drug abusers, you know, they're also one of the people at very high risk of contracting hepatitis B. Yes, so like I think general awareness, trying to create awareness in the public is also a means to preventing this.
So, for someone who has been infected with hepatitis B
Okay.
and cured, can the person be reinfected?
Okay, yes, there's a possibility of that happening. Like we said earlier, it could spontaneously resolve. But in a case where it has resolved and then the person exposes himself to the virus again by the various means we've stated previously, the person has a chance of getting reinfected. However, you know, like when something that is foreign, when the body comes in contact with
Yeah.
something that is foreign, the body tries to create immunity
For next
against
time.
it. Exactly. So the body will just do its own bit to try to fight the virus if it has been introduced again. But in a case where it's unable to handle it, then the person would break down again and the person will be reinfected.
Okay, so what can one do if you're afraid or you fear that you have been infected or you feel like somehow you got in contact with someone that has hepatitis B and you feel
Yes.
like you're being infected? What can one do at that
Okay.
point?
Okay, like I said earlier, generally creating awareness, and part of the things you do in creating awareness, you should talk to the people generally on getting vaccinated. So like I told you, the vaccine has about 95% efficiency. Yes, so even if you've been vaccinated and then you're exposed to the virus, you could just do a viral screening to be sure you didn't contract it because you've been vaccinated. But in a case where you've not been vaccinated, then you may need to take your PEP, post exposure prophylaxis.
Prophylaxis.
Yeah.
Okay,
Yes.
so for someone recovering, how's the recovery process like
Okay.
for hepatitis B?
Okay. I won't perfectly say it's a smooth ride, and I would say it depends on some factors. For example, like factors like age, immunity, the extent to which the disease has gone. When I say age, just like infants, little kids, and then elderly, they are at extremes of ages. So their immunity is almost always
Low.
lower than yes. So someone who is more immune than these people at extremes of age may have a faster recovery rate than these people. Then the extent to which the disease has occurred. If the cirrhosis has eaten very much into the liver, if the cirrhosis has gone very far, then you will know that the rate of recovery would be very slow because the liver may or may not be able to regenerate itself again. So, like I said, it depends on some factors: the age, the extent to which the disease has gone, also compliance with medication. For someone who is very compliant, taking his medications as prescribed,
Right.
may have a faster recovery than someone who is not compliant with medications. That's someone that will take today, leave it till 5 days' time. So the person that is compliant would have a faster rate of recovery than this other person. Then I'll also add this: you can't just on your own say, this patient now with hepatitis B, this is the rate at which he would recover. But then that's why at least 6 monthly liver function
Test.
tests is encouraged. Then a viral load to check up, is this virus reducing or is it increasing
Prison.
despite the medication?
So,
Yes.
as family, what do we do to encourage or help those who are living with hepatitis B, those recovering, those who just found out that they are infected with the virus? How
Okay.
can we help as family members, people in society?
Okay. As family members, what I can say is this. First of all, this patient is now aware that he or she has the virus. So you have to be of optimal support and encouragement to the patient. You have to try to encourage the patient because taking medications daily, these antivirals, they are daily medications, so it's not even easy to take medications daily.
Daily.
So you can support them, encourage them, remind them, set reminders for them: you're supposed to take your medication at this time.
Okay.
Then you could also help them when you see, like, maybe for someone who is maybe an alcoholic, you could help him if it's to taper, because trying to stop the alcohol at once,
May not be
yes, may not
feasible.
be feasible. So you help him taper. Maybe you could give him things that could replace the alcohol. Then you could also help them with their diet.
Okay.
Exactly. Then generally the public, like I said, just creating awareness, encourage wherever you could encourage them, have you been vaccinated against hepatitis B? Even if you don't have the virus, even if you're not infected, but it's still important it's still important you get vaccinated. Yes, healthcare workers as well, because they always face patients. You don't, and you can't just meet a patient on the spot and
start
say
asking.
this patient has hepatitis B. So before you're able to run 1 or 2 investigations to confirm, it's possible maybe there could be an emergency or a rush, and then you have a needle prick. Before you know it, the person has already
Been
contracted it.
exposed,
And one thing is that Nigerians are really, really scared of the HIV virus, but unknown to them, hepatitis is 100 times more deadly than HIV. Reason is this: hepatitis has no cure. Hepatitis B does not have a cure. But for HIV, if the person is very, very compliant with his heart, highly active antiretroviral therapy heart, if the person is very compliant with it, the person could live a very normal life. The viral load could be reduced to such a level that it can't be transmitted to another person. So even in the theory, in the theory of threes, you would see that when there's a needle prick, there's 0.3% risk of contracting HIV, there's 3% risk of contracting hepatitis C, and then there's 30% risk of contracting hepatitis B. So yes, so that's the rule of 3. So you see, when possibly maybe a surgeon or a healthcare attendant, when the person has a needle prick or something, the person is so concerned, HIV, but not knowing the risk of contracting it is very minute as compared to that of contracting hepatitis B.
All right, let's talk about societal stigma.
Okay.
You know, we fear what we don't know. I feel if we know more of these things, we are less scared of it.
Yeah.
And stigma in the society has its way of making people cover up a lot of things, because I'm afraid to say I have this.
The people would
segregate, segregate and then you start seeing the news flying up and down. So is the people having that are infected with this virus, yes, how do you think, like, how can they move away from that consciousness of stigma? Like, you know, you're talking about you were talking about awareness. Now, for someone who is infected to have that boldness to come and give awareness, whether we like it or not. Once we just hear some example, when people started coming out and saying, I have HIV, I have HIV. In the beginning, when you look at them, like, this fine boy, this fine girl gets HIV. So how do people living with hepatitis B learn to come out of that fear of stigma, that fear of being separated from the society? Imagine someone having hepatitis B and everyone, like someone knowing about it, and then the person goes to look for a job. You know, once the person leaves that office, that's the next thing they're going to be talking about. So people don't believe that people having this virus can actually live a normal life. So how do people now come out of that shame, that fear of stigma and everything, and encourage or speak out about it?
Okay, so I guess I would say, as a practicing doctor, one of the things we learn and we want to put into practice is having empathy. You don't see someone, and then privacy is one of the rights of the patient. Yes, you don't see a patient, maybe patient comes to you and the patient already knows that he or she has hepatitis B. Patient meets you, I want you to be my healthcare provider as a gastroenterologist, and then you begin to discuss it with everybody you come across. No, and then you must have empathy. When you encourage the person, you counsel the person, you tell the person hepatitis B is not a life, or it's not a death sentence. You can live with this but still go about your normal day-to-day life, provided your adherence with your medications, your compliance with them.
Okay, so I'm more concerned with people who are infected.
Okay.
Like, how do they build that confidence? Okay. How do they build that courage they need? because we've already established that the mind works with the body.
Yes.
Because even when they are getting their drug and everything, and maybe the load is going down, there's this thing that affects their mind. And you don't know. Example, this is a diagnostic center. Some people will come and do tests and would see probably the issues affecting them. But I find it that if my neighbors, they are coming to do tests where I'm working, they feel shy. And I tend to, for those that they feel shy, not like those that are not that bold, because of the fact that they feel shy, I hide myself
so that they can
feel
someone else can
comfortable.
address
Someone
their
cannot talk
issue.
to them. So how do people now living with this infection gain or master that boldness and courage?
Okay, like I was saying, just like now in psychiatry, one of the major means of handling some cases like depression is cognitive behavioral therapy. Cognitive behavioral therapy is just like a form of counseling where you're talking to this person and then relating it such that you're talking to the mind of this person. It's just a form of encouragement, and then it's just a behavioral therapy. Exactly. So like I was saying, as a healthcare provider, is one of your duty to counsel this patient aright. Let this patient know that yes, you have this, but it's not a death sentence. Yes, you have this, but you can still go about your normal life. And then the fact that there's improvement, it should encourage the person.
Yeah, that something is happening.
Yes, I'm getting better. What if I hadn't started? What if I've not started these medications? Will it be preferable to die than to get better? So I feel majorly just the encouragement they need, because there is nothing more better you can do for them per se. Just like in psychiatry, someone that is very depressed, but just with cognitive behavioral therapy, you could bring them out of that depression.
Thank you so much, Dr. Favor. This has been an educative journey. And in as much as we always hear every time, hepatitis B is more deadlier than HIV, you should know that it's not something you should be scared of, or it's not something that will make you not come out of your house anymore because you're afraid, or maybe you find out someone is living with hepatitis B, you're afraid that this person will expose you to it. No, it is something that we can actually manage as a community, manage as a person, and also help the people who are infected with this virus to live a healthy life. It has been Health Unplugged, brought to you by Lifeway Medical Diagnostic Center. And we just concluded a discussion on hepatitis B. My name is Amazing Rita.
And my name is Dr. Dimba Favor.
Yes, until we come your way again with another exciting and educative topic, I'll see you next time. Bye for now.